Hi, I'm Dr. Noelle Lucas, and I work at Blue Oasis Pet Hospital, and I'm here to answer some questions that you might have about cat surgeries. And I have an assistant that's going to ask me a few questions.
Dr. Lucas, what questions should we ask my vet before and about my cat surgery?
So your questions about cat surgery really involve what type of surgery your pet's going to have, right? So if your cat is going to have a neuter or maybe a spay, you're going to want to ask, what are the aftercare instructions? Do I have any wound care that I need to do? What do I need to watch for regarding that surgical site? If your cat is having anesthesia and surgery for dental health issues, then what kind of foods can they eat, maybe how to take care of their teeth afterwards. So really the kind of questions that you ask is going to really depend on what type of surgery your cat is going to have. And your veterinarian, especially here, we're going to give you some real specific aftercare instructions on how to take care of them at home.
Will my cat be intubated for surgery?
Yeah, so if your cat is having any type of real surgical procedure, here at Blue Oasis, we are going to intubate them. So what is intubation? Intubation is when we take an endotracheal tube, which is a tube that we are going to put down there into their tracheas through their mouth, and it's going to control their airway. So we can control their oxygen levels, and we can control their breathing. We can protect their airway from secretion, so saliva or gastric fluids, so tummy fluids coming up into the back of the throat and causing problems with their lungs and breathing.
How will my veterinarian communicate with me after my cat surgery?
So after your cat has had surgery, then there is going to be aftercare instructions that will go home. So we here at Blue Oasis will have the cat owner, pet parent, go into an exam room. We're going to go over those discharge instructions. Often a pet nurse, especially the one that's usually involved in the care of that cat, is going to go over those instructions with you, make sure you understand them, and even have you signed consent that you received those instructions. But then we're also going to be there for you after you take your cat home. And in the way we are doing that is we have an aftercare telehealth app, so called Anapanion. So if you get home and you have some questions about your cat and what they're doing after surgery, or you're just uncomfortable with something, you can reach out to us through that app and we can answer your questions while you're at home.
Last question, will my cat be in pain after surgery?
So the answer to that is depending on what kind of procedure your cat had, it depends on the pain level that they're going to have. We do use a lot of preemptive pain management. So that means before we do something painful to your cat in the surgical site, we're going to preemptively give them pain control. So how do we do that? We're going to use pain reliever medications like narcotic pain relievers. We're also going to use local nerve blocks. So that would be like a nerve block in the mouth, similar to when you go to your dentist and they do a block in your mouth. So we do that too for your cats. Same with their surgical sites. If they're having a spay, we'll use local nerve block in that surgical site. Again, trying to keep pain at a minimum. And then we're going to also give your cat pain medication to take home so that they're going to continue to have pain control therapeutics at home so that we can minimize pain. But in the end, surgery is surgery. Surgery evokes pain. We can't take all pain away, but we do our very best to reduce the pain that your cat is going to have. We do invite you to ask questions. We want you to know what kind of pain relievers your cat is having and how we help keep them comfortable and keep them moving forward in the recovery at home. So please ask us these questions. We are happy to tell you all the things we do, and we invite you to reach out to us to ask those questions. Thanks.